reasons to get distracted, but you're here. And so we're excited for this last panel. I'm going to hand it over to one of our superstars, Mr. Dustin Robinson. If you don't know him, he's Mr. Cannabis Law. I'm sure you do know him. We're handing it over. Thanks, Dustin.
Thank you all for coming. My name is Dustin Robinson. I'm the founding partner of Mr. Cannabis Law. It's a full-service law firm for the cannabis industry and psychedelic industry. Today we're going to be talking about CBD, the business opportunities, and some of the obstacles. Before we jump into that discussion, though, I'm just going to give the panel an opportunity to introduce themselves. I've worked with all three of these people in various capacities, and they're all awesome human beings doing great stuff in the industry. So I'm going to hand it off. I'll let Arby start off.
Hi, my name is Arby Barroso. I'm one of the co-founders of Green Roads.
Wow, that was short.
Straight to the point.
Super modest, super modest. The man is a pioneer in the industry as well.
Pioneer in the industry. Hi, I'm Masha Bellinson.
Thank you, guys.
I work with ACS Laboratory. Arby, you were one of the first people I saw speak a couple years ago, and I can't believe I'm on stage with you, but you are the pioneer.
I appreciate that. Thank you so much. Thank you so much.
Good afternoon, everyone. My name is Ricardo Alvarez. I'm the South Florida Regional Director representing the Office of the Commissioner of Agriculture for the Florida Department of Agriculture and Consumer Services, and also very happy to represent the Director of Cannabis, Holly Bell, here in South Florida. Thank you.
And so just to give kind of like an overview of what's kind of brought us here today is we had the 2018 Farm Bill that legalized hemp from a federal perspective. But what the Farm Bill did is it also left it to the USDA to create a federal hemp program, and it also reserved authority to the FDA to continue to regulate CBD when it's used in food, cosmetics, not just CBD, any hemp products. So you have not only 2018 Farm Bill, you also have the USDA to deal with, and then you also have the FDA to work with, but then there's also each state has their own programs. So that's kind of the legal landscape. After the 2018 Farm Bill was passed, we had the interim rule from the USDA. That was in October 2019. And then just recently, last month, the USDA finalized that interim rule, and they actually changed some stuff from the interim to the final rule. So I'm going to start off. My first question will be for Ricardo. I know FDEX has done a really good job kind of bobbing and weaving as the USDA has kind of changed their position with respect to some of these different things, such as the 15-day to 30-day testing window. So my question for Ricardo is just kind of to describe what kind of complexities that cause at FDEX and how you guys have kind of managed to change your regulations and keep up with everything.
Oh, yeah, certainly. You know, the great thing about our program in the state of Florida is that it's actually pretty much kept in line with the USDA from its very beginning, which is awesome. But as a result, also, by keeping in line with them, we've also kept in line and, for example, went from having a 30-day window to now a 15-day window, which now we have to backtrack because of the new changes, which allows for a 30-day window. So, you know, definitely keeping in line and trying to do everything how the USDA wants it, how the federal government wants it, has been complex alone as it is. I mean, that's, you know, everyone here knows how that can be with the federal government. But also it's basically just has us on our toes, and we're just constantly doing, I think, what we do best, which is really just adapting to the situation as it moves forward and changing accordingly, which is what we're doing right now. With the new changes to the USDA, we're already now in track to do those changes and to update as well our rules.
That's awesome, yeah. And just so everyone knows, so the USDA, those interim rules for the states, they have to be just as strict or more strict than those USDA rules. So what happened was originally Florida had a 30-day testing window when you're going to harvest your crop. Then the USDA interim rule went to 15 days, so Florida had to change their rules to 15 days. And now in the final interim rules, they went back to a 30-day period. So, you know, when people talk about what the state rules are, you guys also have to understand that they have to work within the USDA's regulatory framework as well. So to that end, you know, with the 15 to the 30-day window, Masha, I know you do a lot of work with ACS. So if you could kind of explain a little bit about how that's impacted things, that 15 to 30-day window.
Sure. So ACS Laboratory, we're located in Tampa, right outside of Tampa, and we test hemp from 49 different states now, probably have about 1,000 hemp clients. But in Florida, hemp clippings was something new that I helped launch, that program. So before, we had hemp flower samples sent to us from other states. In Florida, when the law passed, so the laboratory had to go out and do the clipping. So we had to send a representative to do the clipping, which is pretty much a whole other business than just receiving the sample and testing it. So when the clippers go out, they have a whole protocol that they have to follow. It's very, very specific. They have to take, from like 4 or 5 different clippings. And when there was a 15-day window to do those clippings, of course, everybody, it was like fire drills all the time. Can you come? Oh, I have 15 days, but by the way, I only have 5. And then it's just constant stress. So with 15 days it's only 2 weeks, and to have that time and then to get the results and not have enough time to react for the farmers, that's really stressful. And so that's a huge, I think that's a huge difference. 30 days, they have more time. So let's say they test, in between, and they get results back, and there's something that they're not expecting or something that is derogatory, they can right away correct it. So for example, if they test within 15 days, which was what it was the first time, this time it's 30, and it looks like it's going hot, the crop, then they very quickly, they wouldn't let it harvest anymore. Whereas in the past, it could have been too late. So definitely we'll reduce the fire drills, hopefully, and a lot of stress, and allow the farmers to do a little bit more product development, which is a good thing.
Awesome. Thank you. And by the way, if any of the panel members have anything to add to any of these questions, feel free. This is open discussion. And so we talked a lot of what we just discussed is on the farming side. So kind of the regulatory framework for that is really the USDA and the state hemp program. When you're going more towards the retail market and you have a brand, it's more so dealing with the FDA. And the FDA has come out and taken the position that CBD in food or as a dietary supplement is not allowed. And that's caused tremendous complications for the industry. I'm sure probably all of us have seen products on the market that are CBD in food or CBD being sold as a dietary supplement. So I get calls nonstop from people trying to understand, how to navigate around that and what they could do to set themselves up for long-term success. And I know Arby has done an incredible job. He's been in it from the very beginning, bobbing and weaving with every single change of the regulation, and I know he stays on top of it every step of the way. So, Arby, how do you handle these FDA stuff? How do you kind of bob and weave through it?
Being nimble for sure, and I want to thank FDAX and Holly Bell and Nikki and Marsha and ACR. You guys have done a really great job. We helped pass the pilot program here in 2017, and Nikki's been essential, and Holly's been essential for where this industry's going. So I just want to thank you guys first for all the work you guys do. On the FDA side, I mean, we kind of finished everything in the state. So Florida, SB 1020, HB 921, those things kind of set the state. So what we decided to do is obviously start working on the federal side last year in February. So we went to Washington, D.C., we sat down with some of the people from the FDA. We had a lot of great partners in the space that were also there, and they drew up a guidance package. So we had a follow-up call with them on July 23rd, where we actually had a little presentation that we wanted to give them. We had 50 companies on this Zoom call. We all kind of signed off on 5 opinions that we felt that the FDA should do. They had already written their guidance. Then we spoke to the White House OMB on the 30th of July. So we've been really targeting what they're trying to do in the space and kind of give them an opinion, because every time they come out with a rule, it kind of cools the market off. And that kind of hurts the whole space. Mm-hmm. So what we've been trying to do is get extremely involved on that side with the FDA. The USDA, we really don't play with too much. We leave that to the professionals up here. But the FDA is big in reference to where it comes out. So we know that they just pulled their guidance package just a couple weeks ago. So we went through a year of working and just kind of poking at their ear and kind of nibbling at them. And now we kind of almost have to start all over again. But we feel confident in the space. We really think they're going to come out with something where a consumer could trust the product, they're willing to take it. Because every time something comes out, oh, you're not taking a product that has CBD in it, might have nothing, and next thing you know, like people don't want to buy the product again. So being part of that, you know, hopefully that road with the FDA is going to be big for multiple reasons, for the space, for guidance in the space, because there's really no blueprint. And we've been trying to figure out our own blueprint for the last 9 years since we started in this space. So we're positive though about it.
Awesome. And so, you know, I get a lot of calls about CBD. I think that's kind of the hype. Everyone's super excited. But like I always try to tell people, you really want to think of CBD as just one ingredient. So the entire hemp plant has been legalized, and the hemp plant consists of a lot of different cannabinoids. CBD is just one of those cannabinoids. So there's been a few cannabinoids that have been getting a lot more hype and create some unique opportunities. First it was CBG, then CBN, and now we're seeing tremendous excitement around Delta 8 and Delta 10. And there's a lot of gray area with them because they are intoxicating. So I work with a lot of clients trying to kind of navigate that gray area. But our argument is as long as those are derived from hemp, they are legal. Now, the way people are creating these cannabinoids is through, in large part, a synthetic process. So that creates kind of an additional legal complexity. So I'm going to let Masha just give a little bit of background on, just educate everyone on what D8 and D10 is. How is it different from Delta 9 THC? So Delta 9 THC is what most of us are probably familiar with. But tell us a little bit about Delta 8, Delta 10, and what complexities they have when it comes to testing them.
Sure. So there's about 112 cannabinoids that we know of, probably more. And Delta 9 THC is what, you know, that's what all the hype is about. But it's kind of like wag the dog, because we're paying attention to this other thing. But meanwhile, there's all these other cannabinoids that have, we're not even at the tip of the iceberg. Like, we have no idea because there's not enough research. There's not enough studying. There's not enough trials and all of that. So Delta 8 is another cannabinoid. I guess it's one carbon less. I'm not a chemist, but there's just, you know, it's a small variation. It still interacts with the endocannabinoid system. It works with similar receptors as Delta 9, but it's not as absorbed. So because it's not as bioavailable, or it doesn't bind to the receptors the same way, you're intoxicated, but you're not confused. So you're like, you know, you're high, but you're not like, you're just kind of like a little high, but you're not really sure. So
you're confused.
Yeah. And then
just a little confused.
Just a little less confused. And then so it's sort of like the indica. But I even hate the word indica because, you know, it's all about terpenes and all of that. But that's the point, is Delta 8 without terpenes, there's like no steering wheel. So you're just kind of like, all right, I'm high and I'm here. So Delta 10 is found in very small traces. So Delta 8 is found in larger traces. Then there's Delta 9. Delta 10 is found in very small traces. But what's important with testing is Delta 10 is, like, a lot of times misread as CBC or CBT is what I researched. You have to be a DA licensed laboratory in order to buy the method to test Delta 10. So not to bore you guys to death, but so in order to know how to test anything, there has to be a standard, right? It's got to come from somewhere. And so to get that standard, you have to be DA licensed. Now, Delta 10 is not DA regulated yet. So it's under a different jurisdiction. That being said, I've not tried Delta 10. I'm expecting some any minute now because we did start talking with we're working with a manufacturer. We started testing for it. So the difference now, which is pretty cool, is if you're testing with an advanced laboratory that uses the right kind of equipment, it's a liquid mass spectrometry. I can never say this. And so for example, to test Delta 9, maybe the machine runs for 9 minutes, 10 minutes, and then it's done. But to test Delta 8 and Delta tend to break out these peaks because it creates these peaks. When it measures it, it's about 20 minutes. So most labs don't want to test for 20 minutes. It costs money, time, all of that. So what's been happening is the Delta 8 tests have not been accurate because it groups Delta 8 with Delta 9. It doesn't break out the peaks. Same thing, Delta 10. So if you're taking long enough to test, then you see how the peaks break out, and then you can just focus on what is that Delta 9 count, because for hemp, always watching to make sure it's not over 0.3. With Delta 8, a lot of times we get a lot of products that are tested and they're coming out hot, but they're not. It's just because they're not tested properly. You've got to split those out. So that's a new method, and that's almost like instant remediation, which is kind of interesting. So if someone comes to us and they're like, well, we've got this Delta 10 product, it's testing hot, we were told it wasn't, this lab is testing this way, and then we developed this new method so we can hopefully alleviate a lot of issues. The other thing with Delta 8 is because it's so new and everyone's only testing for potency, right? Because they don't really have to do anything. They're missing residual solvents, heavy metals, all these things that are found in the product. So yeah, everyone's super excited. Here's this new happy cannabinoid we just found. Let's get high and not tell anyone, and no one will know. But it still has to be it still has to be good medicine at the end of the day. So it's important. So while I'm the first one to jump on the bandwagon, I always you need to check. With Delta 10, I'll be getting some samples, and I want to do an experience blog. So that's the other thing, to have people experience it and write about it. That's the only way, because we can talk about it all day, but yeah.
Yeah, and I think Ricardo probably has something to say about that. I'm actually going to ask Ricardo a question on it because, obviously Florida Department of Agriculture is also the Department of Ag and Consumer Services, and being that this is now a compound, I think the regulations as we have them today kind of assume that if it's coming from hemp, it's not going to be intoxicating. So they're drafted as such, right? They don't really take into account that some of these cannabinoids could be intoxicating. So I know I've had calls with Holly Bell and some of the people at FDAX, and I've been actually advocating to get some regulations around Delta 8 so that we could protect the consumers and really know what the consumers are getting. So I'm going to kind of throw it to Ricardo if he has any comment. And by the way, part of the complexity, I give it to FDAX, part of the challenge with regulating Delta 8 is this testing challenge, is that FDAX is basically, well, I'll let Ricardo say what FDAX's position is there.
Well, I mean, obviously, yes. I mean, it's still what's definitely called a gray area. It comes from hemp, so therefore it's hemp. There's still no rules on it. And going back to the whole complexity thing, I mean, at the end of the day, we're the agency that writes the rules, but we first have to have legislature allow us to write those rules. So they write the laws that we can write the rules upon. So going back and forth with legislature and also being in compliance with the federal government is tricky. And all I can say on Delta 8, which is it's already talked about, and Delta 9 and Delta 10 and all the other cannabinoids, is that we're trying to catch up as it becomes available to us to catch up. But it's a tricky process. I'm not gonna.
Yeah, it's tricky, and just to kind of elaborate on that.
We have no rules on it. So
there's no rules, and my concern is that with the way the rules are right now is that really the only age requirement is for inhalable products over 21. For edibles and stuff, there's no age requirement. So technically, you could have an edible Delta 8 product in a gas station or some other retail shop, and potentially a young child could go in and purchase that. So, this isn't just let's create regulations so we could create regulations. It's no, let's create regulations to actually protect the consumers. And like Ricardo,
we're taking that very seriously.
Yeah, like Ricardo said, you have they need to get their authority from the legislator. So, it really starts with the legislator actually catching up with what's happening and taking some action. So I also want to ask Ricardo, talking about inhalables. I know that the legislator did take some action in allowing FDAX to regulate inhalables. That's kind of been a really big gray area for Florida. The legislator didn't really let FDAX regulate inhalables, so it was kind of in a world of its own as far as hemp inhalables, and that includes flower, not tinctures, extracts that are inhaled, vape pens, stuff like that. So, Ricardo, where are we at with inhalable rules?
Well, that's another one right there. We're moving along. You see, there you go. That's a good example. We finally do have the ability to create rules on this, and so we are working on it. We will get there. I don't have a date yet for it per se, but we're definitely already working on that, and that will come ASAP. But yeah, that's another one where hemp flower, all that is just, total gray zone. And but it will happen. And at the end of the day, the flower does have to meet federal requirements. So no matter what, as long as the flower has the correct, COA, all the paperwork is there, then it should be all right. I know someone who has who's doing like a hemp nursery, and he's doing like a U-pick with his flower. Okay, people are coming by and they're doing U-pick of flower. All right, I mean, it's something he's doing on a very experimental level, but it's there. And so it's like, he asked me about that. I was like, what can we say? You got the nursery license? Perfect, great. You have your grower's license? Great, perfect.
Yeah. And FDAX has been great about that. I mean, there's so many creative ways to get into the industry.
Absolutely.
And as long as you're not violating a law, like FDAX has been really good about kind of working and providing guidance on saying hey, as long as you're complying with the federal law, we don't have anything that regulates this, so you should be pretty good with that. So they've been really good. So I'm going to ask Arby. So, I get a lot of calls from CBD companies. Everyone and their mother wants to start a CBD company, start an e-commerce business, and it's getting tremendously saturated. I've probably convinced more people not to get into the CBD space than I've convinced to get into it. I'm not even joking. And I probably saved people more money, wasting time and money getting into it and losing that money than I have making money getting into the industry. So Arby, I know he's been in the industry for a long time. How do you differentiate yourselves? How do you have all these different brands coming out every day? It seems like there's 100 new brands. How do you differentiate yourself and
being nimble? That is for sure. But for us, what we've been able to do is we're a CGMP. One of the big things that we just did now is our OTC license. So now we could actually create products and actually put a reason behind why you're taking the product. So let's say sleep, immune boosters and stuff like that. And what we'll do is we'll add an ingredient to that to be able to make that claim, and then use CBD or cannabinoid as an ingredient on the product, but really target, let's say, a menthol or something for sleep on that side. So that's kind of how we've kind of continued to evolve. A lot of people are trying to get in the space, and I applaud them. I literally have conversations a couple times a week, trying to help guide the direction that they want to go. Just kind of telling them, listen, know your labeling requirements, make sure you're using the right labs, make sure you get a good partner in the social media platform, because you got to pick a certain product. Don't make 50. Get 3 to 5 products that you're going to be really good at. There's a story behind the product. Just don't put a tincture on there and just put a label on it and think it's going to go out. Make sure you got your QR codes right. Understand what states are doing, individual states. So you have Texas almost that follows Florida guidance. You have Indiana that has that QR code. So if you're trying to sell a product in, let's say, Florida, and you don't have a QR code on it with an independent COA, you could get pulled off the shelves here. So those are the kind of things that I try to help guide in this space. But just make yourself different by knowing your why, what your story's about. Create a product that means something to you. Just don't think that you're going to make the money on it, because there's 3,000 different CBD companies out there. So you really got to differentiate what you're trying to put out in the market to be successful, and then really understand the social media platform of who you're going to use. And Doree's back there and could probably help you in reference to that side. But just understand what you're trying to do, and just don't try to get into it for the money. Because if you do, just like in the cannabis space, people think they're going to get into the space for the money. They turn around, they blow a lot of money, and they get nowhere, and then next thing you know, they're selling their license or just getting out of the business. So just know the direction you're kind of going in.
Absolutely. And so another issue is, people think because now the 2018 Farm Bill has legalized hemp that banking, payment processing, insurance, all that stuff is going to be a cakewalk, and they're very frustrated to find out that those things still are not easy for the industry. And so I want to ask Arby how some of his horror stories. I know he's gone through a lot with payment processors and stuff like that, and kind of any advice you could give to people as far as how to get around that, as far as insurance, payment processors, banks, all that stuff.
Be truthful, because they'll hold your money. We've had our money held for 270 days at one point. Probably been through like 10 banks across the board, starting with Wells Fargo, then Florida Community Bank, and then Chase, and we could just go down the line of all the banks. And then US Bank shut everybody down, Avalon, in 2019, middle summer. That's kind of when the whole product, and we actually started getting terms on our raw material, which was kind of weird. After 5 years, 6 years of paying up front, we actually got terms on them. So just know the bank, go in there. And there is processors out there right now that are actually working in the hemp and CBD space. So just ask the right questions. Don't try not to go through a broker, because they're just trying to connect you with a bunch of different people. And if you go get thrown into 5 or 6 different processors and they run that application, you get turned down by all of them, then you might have a harder time getting that processor. So just understand who you're dealing with, or go to the bank directly. There is smaller community banks that are working in this space, and they're very friendly to the space. And just be smart of who you're dealing with, because if not, they shut you down, and then you're gonna have to go fight for your money, and they typically keep it for a very long time. So, and it's in the contract. So make sure when you read the contract that it says right there they can hold it for 270 days. So just know when you're going off and you're going through that, know what your reserves are, if they're keeping 10, 15, 20%. Know what you're signing on that paper, because if you sign the wrong one, you could be in big trouble.
And what about payment processors?
There's a few of them out there. There's really good ones. I mean, we've lost Square. We went through all of those too, so we went through all of them. I think Square's back on, but they're getting really picky about what they're doing. There's a company called Blackstone that we used for a really, really long time. They're very friendly to the space. They're still available. For us, we're going through banks now, so we get a better interest rate, better charge rate and stuff like that. But there's really good processors out there. I would call Blackstone. They're local, and they're really friendly to the space.
And what about not having the word CBD or hemp in your business name, so that the merchant processor is going to flag you immediately?
They'll go to your website. That's the problem. That's the challenge in the space, is that you write the company, they will be somebody on that. They will be a secret shopper if they're against it. So don't go to a bank that's going to be against what you're doing.
Right.
You're going to have to go to sleep every night worried about putting your head on the pillow and not knowing that the next day you have $20,000 worth of charges and you're not getting the money. So just know the space. They're open enough right now to, if you do the studying and you do digging, you could definitely find people that are going to help build your business. For sure.
Yeah, it should get better. I mean,
and it's getting better for sure.
Yeah, and there's going to be changes at the federal level with the Banking Act, and hopefully even the descheduling altogether will just wipe that out. But there's a couple banks here in Florida that are also very friendly to it.
Something that someone just told me about was that their bank initially asked for a COA of just potency, and then when they asked for a retest, they actually shut them down, because that retest, which was a full panel, had heavy metals in it or something. So while it may seem like, okay, let's just do the bare minimum, you have to always think ahead. So,
well, I think now in Florida, you got to have full COAs now either which way. So that's so important. And the Delta 8, you don't have to. That's kind of curious.
Well,
you don't have to.
Yeah, it's sort of a gray area, right? Like Delta 8, if you're a Delta 8 product, you're.
Because that's going from paying $70 to paying, $300-400. So people go to pay the $70 and they don't know that they got a product that has metals, pesticides, and different things.
Right.
Yeah. Well, speaking of all that, I mean, I know, there's a lot of probably consumers out here that, not just businesses, but consumers that are using products. And I know it could be very complicated as far as picking the right brand, figuring out what dosage you should take. There's a lot of misinformation out there, and there's a lot of brands that are making representations about the CBD levels that aren't true, or there's lead in them, or residual solvents. So Masha, any advice for consumers as far as kind of figuring out what type of CBD they should be using, the brand, even whether they should use an edible, a tincture, and what dosage they should be going at?
So I think, of course, you want to look at a brand where you can see what their test results are. Of course, I'm going to say that, obviously, right? So it needs to be transparent. It can't be hidden. You can't try to figure it out. If they're making claims right away, no matter how amazing the product is. So they cannot make claims. I was working with a woman that has her cows shipped in from Eastern Europe. She uses like the microbiome from the cows for the compost to grow the plants so that they vibrate. I mean, like wild stuff, right? So while that all sounds amazing, and I say, well, are you testing for, pesticides and heavy metals? And she's like, oh my God, no, like my product doesn't have that. I use the most pristine. And it's like, yes, I love your story and I get that, but you still, you can't, a lot of entrepreneurs fall in love with their own products. So we have to really look at it like, does it resonate with you? Because if it feels off, it will be. If they're trying to sell you, if they just look too slick, like if there's a call to action form, if they email you 10 times after you've left their site, like, chances are they're trying to sell you. So really, I mean, I just heard Tom Hanks started his own CBD line. And I was like, it's, like you have to trust. I think trust and transparency is really important. And as far as dosage, so a lot of people, when they're doing tinctures, they do it wrong because it's not, you have to hold the tincture in your mouth, for 30 seconds so that it's more bioavailable. And in general, that's the most important thing because if your dosing isn't correct, it doesn't matter how good your product is. So you have to know yourself, know your body. Don't be trying 10 different things, do one thing at a time, couple days, see how that works. Try it once in the morning, once in the evening, and really listen to your body. And
yeah, I appreciate it. So I see hands up. We only have a few minutes, so I'm actually going to open it up to questions. So let's.
As a consumer, you do see a lot of companies making claims that you're less trusting to buy anything in the space. But what I don't see is when you look it up, you obviously buy it as a manufacturer, as a retailer, what the label requirements are, what they should be. Is there ever going to be a spot where, like, as a consumer, I can say, this is what you need to look for before you buy into something?
That's a great question. I think that's one of the reasons why in Florida, which I think we're extremely advanced on legislation, because you have label requirements, you have full COAs on a QR code. So a lot of the states are starting to pick that up. I think we're at 7 right now, and we're trying to push that towards the federal side so the consumer could trust the product. So it's not a lab, a lab. So you do is on the QR code, you just use your phone, it goes up, it pops up an independent third-party lab test, whether it's ACR or ACS, my bad, ACS or any others, you could actually see the full panel. So it'll be like 5 pages. And that's the challenge right now. That's the challenge is that I know the FTC is coming out writing fines right now because people are putting, 30,000 milligrams for $20 on Amazon. So, they're starting to write these companies letters for making claims, which is a great point. You shouldn't look at a company that's, cured this or cured that. We've had to clean our reviews. We hit 30,000 5-star reviews about 2 weeks ago. That was a big milestone for us, because that's a lot of people that have tried our products and given us 5 stars. But even then, we have to go, and we probably eliminated 5,000 of them before because they said it cured this for me or it did that for me. And online, you can't have that because if you're posting it, they're going to come after you. They're not going to go after the consumer. So, yeah.
If you're posting and putting them on your website, if it's like a total third-party website and someone, you can't control what other people say, but if you're allowing them, like Arby on his products, he's got, consumer reviews right on his website. So if he's showing that on his website, then that's attributed to him. And I talk about that a lot with clients. They're like, oh, well, what if I say my client's testimonial and put it on the website? Or what if I put on my website, a link to a research study or something like that? I'm like, no. If you're putting it on your website, it's attributed to you. I don't care if you're having a testimonial from a customer or something like that.
Can you say that you did a study, like that this many people took the product for, like, make it more of like a case study.
If there's and I tell my clients, they get frustrated. Why can't I make claims about sleep? I'm like, have you substantiated that? Well, this, that, and the other, CBD does that. It's like, well, have you done a double-blind placebo study on this? No. And so, yeah, if you want to develop the clinical research to back your claims, then yeah, that's a potential
But there's
pathway.
also another way around that. We make a claim on our sleep, but because we have OTC. So if you're going to go and manufacture with a company and make your own product, go, which we don't recommend. We do everything ourselves. We manufacture all our products from beginning to end, except for the edible line. But we do that, and now we're able to do it because of OTC. So if you're going to launch a product, you want to focus on a certain thing, you could actually launch it with different cannabinoids. You can't mention that the cannabinoids are doing this, this, and this, but the other ingredient is. And the cannabinoids are just an add-on
So
to that
if you
product.
add melatonin to it, then you can, because melatonin.
So that's our sleep
right,
product
right,
we
right,
launched
right.
2 months ago when we got our OTC, and now we could use sleep all over it. So we SEO sleep a lot. We go after certain targets now, and now we're coming out with a pain, and we're going to call it pain because we have certain ingredients in there. So there's ways of getting around that. We could actually target and launch a product. If you're going to manufacture through a co-packer, just make sure they have possibly an OTC license, so then you could actually go and use that OTC for a reason.
I could say also from the regulatory side that we take our division of food safety takes that very, very serious, and so this is something from the very beginning that even before the program began, the commissioner was adamant about that. Food safety and protection of consumers is at the highest priority, which it is, and so we're getting there. It's obviously monumental because we know that CBD products are sold everywhere in Florida. But little by little, we're getting there to inspect every place that has it, to have everybody licensed. And again, we depend on consumers as well. So if anyone ever encounters any products that are not good, please, report them. You can report it to the Division of Consumer Services. We have a helpline. You can send me an email about it, and we will follow up on it. We will act on it. It's something that we do all the time. So yeah.
Other questions? Yep.
That young lady.
That might be a little more complicated. I can't answer that one now.
There's a couple banks that are openly that they also service like the marijuana industry.
Florida
so
National.
yeah,
Actually, Lafayette.
Lafayette State
Lafayette.
Bank.
Yeah,
They're
Lafayette.
they're pretty good. First National is another one. So those are kind of my two go-to banks if you're really not. But at the end of the day, it's kind of hit or miss with some of these banks. Like you could go into your Bank of America and they could sign off, and one branch might have no problem with it, another branch might take issue. So I usually tell people, start off, just go to your bank, see if they'll clear it. If that doesn't work, we have some backup plans. Of course, you got to pay some higher rates sometimes at those other banks. So if you don't have to go to those other banks, I try to avoid it. But sometimes if you got to do what you got to do.
Are there credit unions that are like cannabis or at least hemp friendly?
Yeah, there actually was one bigger one like a few years ago, and they ended up shutting down. But different states have different options for banking. But here in Florida, we're relatively limited.
What's your best timeline on FDA CBD?
I wish the timeline would have been this month, but that didn't happen. We are having conversations. We're on quite a few boards, including we work with the NIHC, which is in DC. They're the ones who help push that and get us in front of the FDA and stuff. We're pushing them again, obviously, because they pulled that guidance package out. So that's literally our goal this year is the partners that were on that call were great CBD companies, manufacturers, Truckers Association, Consumer Protection. So it is a big group of us that's trying to maneuver them into coming out with something. So we're hoping that it follows Florida. I think we have great rules here. I think our commissioner's done an amazing job. I think Holly Bell is very open to the industry. The farmers are doing great. And I think we've learned a lot from our mistakes that we made in other states. And I think we're not making those same mistakes here, and hope not. But I think the FDA is paying attention. I think our commissioner also is in conversations with the FDA, highest ranking Democrat here. They got all three branches up now. So we're hoping that something soon will come out.
I'm thinking about more 2 years or like 5 years.
I don't think they'll come out with a phase 1. So this guidance package was going to be a phase 1. It wasn't going to be an all-in. It was going to be, wasn't going to call food. It wasn't going to be supplement, but they would have had guidance, whether it's labeling requirements, maybe age restrictions, certain things that they might have want to come out with that we were hoping they would. So the food and supplement side, I don't see it coming anytime soon, but certain kind of guidance will definitely come in, I think, in the next 6 or 7 months or sooner.
Any other questions?
Well, I actually have a question, but why not just call it hemp in food? Why do you have to say CBD in food? Because if there's, if there's a full spectrum, it could be CBD, CBG, whatever else is in there.
Part of the challenge and the reason what's caused a lot of the complexity is that we have a drug that has been FDA approved, Epidiolex, that uses CBD isolate. And whenever you have an ingredient that's used in an FDA approved drug, you can't then use that ingredient unless you're going through FDA drug approval. Now, there's a lot of where the argument lies is that CBD isolate is much different than hemp extract that just so happens to contain CBD. So that's kind of the distinction, and so that's why you'll see some bottles of CBD products saying hemp extract. Rather than calling it CBD oil, we're using full spectrum hemp extract, which is much different than using the isolated version of CBD oil. So yeah, that's kind of why they make that distinction about CBD oil.
Interesting. Okay.
All right, I think we have all of our questions. We're past 4:20, so we're past where we should be lighting up. Enjoy your weekend. Have a good one.
Thank you.